like now to invite Tigran Yepoyan and Ekaterina Samoligo to tell us how and why digital tools can and should be used to support school-based health education. And you will also, told me, share some examples from different countries. So over to you, Tigran and Yekaterina.
Thank you very much. I really can't thank Professor Didier enough for this enlightening presentation and very appealing speech that underscores and explains the importance of health education. And one of the questions which I noticed in the Q&A section was that students do not register to health education. What can be done about it? And I want to start with this. Health is not an actual issue when you're 10 years old, 15 years old. You feel quite healthy and no any problems, aches, etc. Well, of course, some people may have health conditions and issues from early on, but in general, for teenagers, whom we're talking about mostly, is not an issue. And that's why health education per se will probably not sound very appealing to them. So you would just call it relationships education, education about growing up, relationships, well-being, skills, social and personal skills building education, etc., that may attract more students to register and participate. And this is not just about changing the title, but about the comprehensive content that such education encompasses. Over the last decades, health education has very much changed, developed. It has become more holistic and comprehensive. I remember the years when it was predominantly about HIV, when the epidemic first erupted. But over the past few decades, many more resources have been created, both for classroom-based instruction and also digital, for students, for teachers, for adults, parents, anyone to learn about body, reproductive health, relationships, etc. Digital tools seem to be really cost-effective when we need to reach out to big numbers of educators, to train them, to deliver health education and support them throughout the journey to truly comprehensive, engaging, inspiring, and making lifelong impact health and relationships education. It is not always easy for a teacher to become such inspirer in a classroom without having other tools like visual aids and other to support and complement what they discuss in the classroom. We all remember the time when schools closed because of COVID-19 pandemic and how education massively resorted to online teaching and learning in contexts where internet and gadgets were more or less available. In general, at that time, health education was not high on the agenda because schools were grappling with the need to deliver core subjects. And along with that, to teach kids and adolescents to wash their hands and maintain social distancing. Nevertheless, at that time, we have seen emergence of some digital tools that provide education on puberty, reproductive health, family planning, and also what was really important, online counseling on these issues to adolescents locked at their homes. And that was really, really very good opportunity for us to negotiate with the Ministry of Education of Kyrgyzstan to develop a suite of videos, 24 videos, on a range of topics to demonstrate and discuss remotely and now in the classroom during obligatory homeroom health education classes. To help teachers organize the lessons, we also put together a manual with 24 scripted lesson plans. They started using them when schools were still closed, but keep using them until now and realize how useful they are, how impactful they are, how easy they make the task for teacher to get prepared for the lesson and run it. These videos can be used for so-called flipped format. When internet is not easily accessible at a school, kids can watch the videos at home or from their homes and then spend the time in the classroom for reflection, discussion, role playing, brainstorming, developing, training some skills, etc. And with over 65,000 views, and I believe that many of them are collective views, when a whole classroom watch the video from one gadget, these video lessons are in demand among students. They find the lessons augmented with the watching and discussion of such videos more interesting, more engaging, and better explaining complex things. This is direct feedback, well documented in many places of the country. And teachers also like these videos as they are ready tools and they don't need to look for any other resources. Just follow the manual, watch the video before the lesson, and then show it piece by piece and allow enough time for discussion with the students. This encouraging feedback from Kyrgyzstan inspired us to create 2 more suites of videos for Kazakhstan and for Belarus. We're just starting this project in Belarus. The videos are ready, and we'll be training school teachers and also teacher educators to advance with health education supported by such internet-based tools, because all these videos are available in YouTube. Greater integration of digital tools into teaching has several obvious benefits. This is our major learning from this over 2-year project. First, we can ensure accurate, age-appropriate, and bias-free content to be delivered in an engaging manner to inform teenagers, trigger reflection and discussion. This is really important, as we not always can ensure that teachers are very well prepared and convey the right messages, free from their personal biases, learning, life experiences, etc. This is also very useful tool when and where teacher preparation and the quality of their teaching is a little bit an issue, where biases are deeply rooted, and we see how teachers struggle to say something which is advised in the evidence-informed curricula, but which contradicts to their own personal life story, and where teachers feel uncomfortable to discuss certain topics. And I have to say that our recent study in Armenia proved that students themselves prefer outside adults to come and talk about reproductive health and sexuality rather than their regular teachers. They feel more comfortable to discuss these issues with someone else. And the video kind of helps to make this distance, make not that personal when you discuss it immediately with your homeroom teacher, for example. Digital tools also provide safe and comfortable space for learners. Online Q&As, quizzes, tests with correct answers, search for information, and self-assessment, as learners feel safer to look for what they want to learn and to check their knowledge without fear of being teased or ridiculed by peer. They can do it in the classroom using their phones, or they can do it at home using platforms with different gamified tools. A study in the United Kingdom, and you see here the screenshots of 2 resources developed in UK, proved that using a digital game to support relationships and sexuality education has led to increased discussion and debate among learners and improved their ability to recognize and prevent sexual coercion, which is really a big issue for teenagers and older young people. But no matter what wonderful tools we have, how many gadgets and how speed the internet connection is, teachers are very, very important more than ever. They are those who create safe space in the classroom, make sure that kids feel comfortable to ask questions, to discuss them, and not to tease each other, and that teachers refrain from any kind of teasing or bullying while discussing such sensitive issues. And these are teachers to ensure inclusiveness and content adaptation, to take into account the needs of different learners. For example, learners coming from migrant families, children having some forms of disabilities or special needs. And teachers are those who can carefully select those digital and non-digital tools which would be appropriate for their students. And they can offer them also different social media communities, articles in the media, chatbots, other tools to complement what has been designed specifically for school. And my colleague Katya will tell more about such digital solutions developed not specifically for school, but which can be used or at least recommended by teachers to their students. And of course, teachers can play an important role to help their learners navigate digital spaces safely, accurately, and find accurate and trustworthy information. To use digital tools in the classroom, we first need to have them, and ideally they are developed with participation of young people themselves and educators. It's absolutely critical that they are relevant to what learners need themselves, not just adults things they should know. And they have to be aligned with the school curriculum. Look at different subjects, extracurricular activities where they can be used. And ideally, they are endorsed by relevant bodies. Teachers, school administrators feel much more comfortable while using endorsed resources. And when we develop such resources, we of course should take account into connectivity and gadgets availability. And thank you, Tao, for mentioning it in your speech. To help teachers use them, we first have to inform about availability of such resources. Then teachers have to like them. And if the resource is not attractive, they won't. If the resource is difficult to use, they won't. But even if it is very simple to use, still we have to help teachers learn how to use these resources, and it takes time. Digital literacy is an issue for teachers and also for learners in some contexts. And of course, teachers have to be empowered to engage with parents, respond to their queries, fears, resistance, especially when it comes to talking about reproductive health, sexual relationships, and other issues. And to help teachers in these areas, we have put together a digital platform, a learning hub. We called it EduHub. It's for Eastern Europe and Central Asian countries, for educators, school counselors, psychologists, youth workers. And every year, over 10,000 people come and participate in our webinars, benefit from self-study and facilitated courses and resources available there. And to conclude, I want to thank our colleagues in the health and education sector in UNESCO headquarters, who have put together this technical brief using digital tools to support classroom-based sexuality education. It's really interesting, short reading, which provides good insights into why such resources are important, how we can use them, and provides also the examples of good practice. Thank you very much.